Hey everybody, Dr. Stoffel here over at the Forge Chiropractic. I wanted to take the time today and talk to you about treatment plans. So, what can a patient expect when they walk into my office? How long might something take me? What are you going to do over the course of my care? Things like that. So, this is going to cover your very, very general musculoskeletal conditions and injuries. So, tweaks, sprains, strains, things of that nature. This doesn't cover post-surgical stuff. This doesn't cover more complex work. This doesn't cover a lot of specific conditions because, again, those are all about what I see in front of me, and that changes how, more or less, how I lengthen and prescribe the treatment time. So this is, again, about your average musculoskeletal condition and injury. Now, regardless of condition, I break care up into two phases, a phase 1 and a phase 2. These phases have different goals in mind, and they have different treatment lengths associated with them because they have different goals. So phase 1. Phase 1 is what new patients or re-exams are going to hear. Phase 1 is all about symptom modification. So that's basically just a fancy term for saying, hey, can we affect whatever it is you came in with? So if you came in with pain, can we affect that pain? Can we drop it from a 7 to a 5 out of 10 if we're looking at a scale? Can we go from it's constant all day, every day to, all right, no, it's most of the day, but I did notice there was this hour block where I felt good. Or, hey, I feel pain when I'm at work. And can we take that and change it to, hey, I felt pain, but only while I was doing these activities at work. The rest was fine. So that's what phase 1 is all about, is seeing if we can actually modify your symptoms. The most common one's pain. Some others might be you have numbness and tingling. Can we affect that at all? Some others might be coordination and weakness. Can we start to affect that at all? And again, that's more patient-based where they'll tell me, yep, no, maybe so. So phase 1 is going to be geared around symptom modification. That usually looks like 2 to 3 visits a week for 2 to 3 weeks. That's just what it takes on our end, the patient and myself, to figure out if we can build a little bit of a treatment going, a treatment for them to affect that condition. So we like to approach it from a multitude of angles. So patients in this phase 1 of care, again, phase 2 if you need it, we'll hit it from multiple angles. We'll hit it from soft tissue. So we can use cups, we can use hands. We've got these surgical grade stainless steel instruments to do some soft tissue work. We will be doing exercise, maybe work modification stuff, ergonomics. We'll be talking nutrition. We'll be doing a little bit of educating. We'll be doing chiropractic manipulative therapy or adjusting. We'll be approaching it so that we can figure out which ones work for you, which ones are best, which ones are actually affecting your condition when you come into my office. So at that end of that second or third week, you're telling me, hey, doc, it's feeling good, it's feeling better. I still feel a little catch, but overall, I'm 50% better. After that, after you tell me that we're working in it, what we're doing here works, we'll move you on to phase 2. So phase 2 is all about building tissue resiliency, getting those injured tissues stronger. The reason for that is we don't want you to always feel like you have to come into the office. There's really no point in basically getting phase 1 treatment care, getting that pain down. It's like, oh, yep, nope, I'm just going to leave. I'm going to head out. It's all better. And then 4 weeks later, you come back. I feel it. It's out again. Something's not right. That means we're just going in a circle. We don't want to do that. We want to get you better, okay? So after phase 1, phase 2 is all about building tissue resiliency, okay? That naturally means that the treatment takes place over a longer course of time because I can't just make your tissue stronger in a week. It takes time. But that also means you don't have to come in as frequently over that longer period of time. So if phase 1 was 2 to 3 times a week for 2 to 3 weeks, phase 2, and again, this depends on your condition, is usually along the lines of 1 to 2 times a week over the course of 4 to 8 weeks, okay? That's the average. So in phase 2, you can expect more exercise, more education, more nutrition work, because that's the stuff that you guys can take after you learn it from in my office and utilize it at home. These are the things that you don't need me for, that you don't need anybody else but you for, okay? So that's where a lot of your treatment is going to lie, is in that education, exercise, and movement, and it's going to lie in phase 2. So to recap, to try and sum this up, and a little inside joke for you guys, I've shot 5 different videos. One of them was like 35 minutes for this, so I'm trying to actually keep things shorter for you guys, because if you're like me, I can't watch videos for more than like 5 minutes. Phase 1, that's your short term. That's seeing if we can even affect your pain or your condition. 2 to 3 times a week, 2 to 3 visits over the course of 2 to 3 weeks is the average. If we can actually affect it and you're feeling good, we move you on into phase 2. That's 1 to 2 times a week, and that's going to take place over the course of 4 to 8 weeks. That way we can build you up, we can get the tissue stronger, we can get you better than when you walked in, okay? That is how I approach treatment when it comes to a patient. That's how I approach phase 1, and that's how I approach phase 2. If you guys have any questions, any comments, any concerns, drop them on this video. You can always give me a call here at my office. You can look me up online, contact me through my website at theforgechiropractic.com. You'll probably have to type in Baldwin, Wisconsin, though. There is a Forge Chiropractic in Alabama. Don't go to that one. I'm sure they're great, but they're not here in Baldwin, okay? Follow me on Instagram, where I talk about fitness and nutrition and what I do for myself. So I'll post videos or pictures of myself practicing what I preach to show you what I do and how we might be able to help you. So again, that's also the same name, The Forge Chiropractic. Shoot me a message on Facebook. I usually respond within the day if you guys have any questions or comments on there. And if you guys have anything that you want me to cover in future videos, I've already got a few lined up, but I am very open and receptive to shooting a video or writing a blog post for anything that you guys want to learn, okay? If I didn't explain this well enough, again, just give me a call or I'll reshoot a video if there's enough requests. But other than that, I hope you guys have a great day, and I'm really glad you sat through and listened to me rant a little bit here at the end. Hope you guys have a fantastic Labor Day weekend, and there will definitely be more to come. See you later, guys.